Okay. Okay, just to remind everybody that it's mandatory to be in class for you to get your full grades for this course and to have your cameras turned on and be involved during the class period. So the questions I have, I know that Ms. Davies, you're the only student present now, but do you have any questions related to anything that would have occurred? I see.
No.
Okay. No? No, okay, good. Okay, let me go ahead and share the screen. We're going to continue today's class with basic first aid. So as you know, basic first aid is when, not basic, but first aid is when the patient or the victim is breathing. As we would have learned in our previous modules, CPR is when the person needs some type of breathing and or chest compressions. So when we look at basic first aid, the patient is breathing. The patient is breathing, but it's serious enough for you to do something, and you need to do that something within a few minutes. In this session, we've already looked at the benefits of CPR. We're going to look at medical emergency, assisting patients with basic first aid, and to do no harm. To do no harm is very, very important. That means you're going to learn some steps that in those steps, you're going to not inflict more injury to the victim. So say, for example, sometimes persons will say, oh, the person isn't breathing. So I'm going to take a knife and I'm going to cut his throat and put a straw in it. That is excessive. You didn't learn that in basic first aid and you're not equipped to do that. So therefore, that means you're going to inflict more harm to the patient, all right? So let's just do a little pre-quiz here, okay? A little pre-quiz here that says, after an accident, true or false? After an accident, immediately move the victim to a comfortable position. Is that true or false? Well, the answer is actually there. It's false, because remember now, you do not want to move a victim who has a head injury. If a person is bleeding, use a tourniquet. Is that answer true or false? And that answer is actually false, because we're not going to teach you in basic first aid to use a tourniquet. Only in advanced first aid, you're taught to use that because you have a little bit more medical knowledge. Signs of a heart attack include shortness of breath, yes. Anxiety, yes. And perspiration, that means sweating. The answer is yes, that is true. All burns can be treated with first aid alone. The answer for that is no, because you have first, second, and third degree. No medical attention is necessary for burns. The answer for that is no. You do need medical attention, definitely for second and third degree burns. Okay, so those were just pre-quizzes just to get you started. So help, I need an emergency. Every minute counts. After 10 minutes of no oxygen going to the brain, heart, and lungs, then what happens? The person will become unresponsive and definitely die, because the body starts as acidotic and the person will then suffer a heart attack and die. Okay, so every second counts. If the person bleed out too much, if the patient is having a seizure, if the patient is having a seizure, there's no oxygen going to the brain, definitely every second counts. So the basic rules for first aid: no breathing. You want to administer the patient on his or her back, give compressions. We already know you're going to give those 30 chest compressions. Tilt the head and breathe into that person's mouth using a mouth barrier device. So we already passed our first aid. So our first CPR. So let's go into our first aid. Bleeding, the number one cause for needing first aid, bleeding. Well, always remember that when you're dealing with first aid, I'm gonna just go ahead and add another slide in here. You want to aid. You want to do another A and an A and an A. The first thing you want to do is assess yourself. Assess yourself. Do I have enough knowledge to deal with this? Then you want to assess the scene, okay? You want to make sure the scene is safe. Always recall that there may be more danger there. You're not a fire rescuer. You're here to render aid to the victim. So you want to assess the scene. Is the scene safe? If the scene is not safe for you, do not attempt to do anything. You want to also assess to make sure that you have enough equipment or supplies available to assist this victim. And then, of course, you want to assess the victim himself or herself. Okay? So we'll keep going back and forth to this. Assess yourself. Assess the scene. Make sure you have enough equipment and supplies, and assess the victim. So when you're dealing with bleeding, of course, if you're assessing yourself, yes, we did a first aid course. We can help this victim. There's no guns or there's no perpetrator around. So yes, I can help. And do I have enough equipment and supplies? Now, of course, this is a gauze. You may not have a gauze, but you may have a nice, clean kitchen towel or something like that. You may not have gloves, but you may have a laundry plastic bag, or you may have a bag from the food store that you can slip your hands into, or the victim may be able to apply pressure himself. Okay? So your equipment is set. Now you want to assess your victim. Is this arterial blood or is this venous blood? Arterial blood spouts around. It spouts, it's all over the place. That is the worst type of blood, the one that looks like it's pumping with the heart. The one that goes with the draining, like what we're seeing here, we could just go ahead, apply pressure, and elevate the victim's hand above the level of the heart. So stop the flow of blood, wear gloves, cover the wound, apply pressure. And if the body part has been amputated, put it in a plastic bag and then rest it on ice. Do not put it directly on ice. Okay? What is the complication? The complication for bleeding is going into shock. That means if the patient is bleeding too much, what happens? The victim will bleed out and then go into shock. The treatment for shock is to lay the victim down, cover the victim with some sort of warm blanket, and then raise the feet above the level of the heart. You can use a box of some sort to raise the foot up. Always remember that you need to call 911, okay? You always need to remember that you need to call 911. That means if you find that this is going to be a real emergency where it's outside your scope, you're going to need extra help, right? In the event that the victim is having a anaphylactic shock, that means they've taken some sort of drug or some sort of medication, or they are allergic to seafood and their airway is swelling off. You want to give them the epinephrine. So they normally do walk around with epinephrine. Call for help as soon as possible and then start CPR if necessary. So that's anaphylactic shock. So for bleeding, you want to apply pressure. You want to elevate that extremity. Remember, if there's arterial bleeding, that is bleeding, that it's spouting, that victim needs surgery. So you need to get into the hospital immediately. For anaphylactic shock, this is a severe allergic reaction to insect bites, such as bee, medicines, or certain foods. What kind of symptoms are you going to see happening with this patient? They're going to have hives all over their body, overall weakness, and swelling of the throat. So you need to get this victim to the hospital immediately. We've already gone over heart attack when we did CPR. Signs and symptoms of someone having a heart attack include shortness of breath, difficulty breathing, anxiety, pressure, squeezing, tightness in the chest, going down the left arm, in the center of the chest. They may have a pain in the jaw or feel nauseated. First thing you want to do is call 911. Make sure the victim is comfortable. If he or she is wearing any tight clothing, check for medications. So you want to loosen up those tight clothing, check to see if the victim is taking any type of nitroglycerin. Keep the victim very still and don't give him any type of coffee or get him stimulated. What you want to do is once that victim collapses, then you want to begin CPR, which is 2 breaths and 30 chest compressions. Of course, choking. Choking is when an object blocks the airway. The victim cannot speak, cannot cough, cannot breathe. A person can choke to death in a couple of minutes. So your job is ask the person to speak or cough. If the victim cannot speak or cough, then you know this victim is truly choking. Normally we do the universal sign for choking. You want to give 5 back blows to anyone under the age of 1 for your infants. And you want to give 5 abdominal thrusts for the infant. But for the adult, you want to do the Heimlich maneuver. So once again, this is just a review of your CPR section. All right. Electrical shock, normally found in persons who work around electricity or children who are left unattended. Do not touch the electrical wire. Remember, you are not a rescuer. Okay, you're not a rescuer. But what you can do is you can turn off the power to ensure that you do not get any more damage to you. You don't become the next fatality. The first rule of dealing with electrical shock is not to touch a person who is in contact with a live electrical current, because that current can pass through the person to you. So turn off the power, call 911, remove the person from the live wire that you've already turned off that supply to, and check for breathing. If the person is not breathing, then you need to begin CPR. Remember, CPR is the person is not breathing. So when you're looking at first aid and you want to ask yourself a question, on the left, there are 5 different symptoms. On the right, there are 5 different actions. Let's look at bleeding. For bleeding, what do you want to do for bleeding? Any one of you could answer that?
Direct pressure.
That is correct. You want to do direct pressure. What do you want to do for choking?
Abdominal thrust.
That is correct. Great. No breathing?
CPR.
CPR, that is right. Heart attack?
Elevate feet.
Elevate feet.
No, keep the victim still. Remember, keep the victim still. And then shock, you want to elevate
the feet.
That is correct. That is correct. Okay, very, very good. All right, so we already went over that. Eye injuries. Eye injury. Remember, eye injury is very common, especially in the workplace. Okay, so this is why when you're dealing with, welding, or if you're dealing with tiling or carpentry, anything like that, you want to wear eye protection. But just in case you didn't wear it and there's a eye injury that occurs, you want to cover both eyes most of the times, because if there is an impaled object. So if the object is stuck in the left eye, you want to cover the right eye, because the right eye moves, the left eye is going to move too, when the object is going to drop out. All right. If you have acid or you have some corrosive substance in the left eye, you want to turn the head to the left, and then you want to pour the water, keeping the affected side down, because if you keep the affected side up and you pour the water, that is going to pour into the other eye and cause problems. Okay, so anything with particles in the eye, you want to flush it out. Any penetrating objects, you want to cover both eyes. All right. In this case, this person looks like he had a balloon to the eye. There may be some bleeding, so you just apply pressure and put your bandages on. All right. Burns. That was one of the questions that came up when we first started earlier, and I asked about burns. Burns are another common emergency, and it's something that happens in the household a lot of time. But first, we need to understand that burns are in order. You can have a first degree, second, or third degree burn. First degree burns are the least severe, but it's the most painful. All right. Normally red and most painful because your nerve endings are still intact. Your second degree burns are more serious than the first, but they include blisters. So you're going to see the little puffles of blister coming up on the second degree. The second and the first degree burn can be treated at home using cool water as it comes out of the tap. And what that does, it just relieves the pain and it cools down the skin. Uh, Remember that the nerve endings are intact in the first and second, so it will be painful. However, now in the third degree is the one where it's the most serious, most life-threatening, where the skin is destroyed down to the third layer. This victim is normally not painful, and this victim needs to be sent to the hospital. Okay, so in our first and second degree burn, we can cover it with a clean gauze, and we can keep it cool with water as it comes out of the tap. When we talk about environmental hazards, like anything that's in the air that you can inhale, that you can swallow, that goes on the skin or the eyes. If it's on the skin, you want to flush the victim down. Make sure you do not pull that clothing over the eyes, over the face. You want to cut it off. That's why you want to have your scissor. Ingestion, you want to lay the victim on the left side. And we say on the left side primarily because the fluid that he or she ingested will actually drop to the bottom of the stomach, and it will be less for the patient to have an opportunity to have that go through the body, through the duodenum into the system. Okay, so you want to lay the victim on the left side. As you can see, this victim is laying on his or her left side. Broken bones. Broken bones first. Remember, assess yourself, assess the scene. Is it safe? That's you step on the stair, you too may fall. Okay. Look around, ask questions, and then treat the victim for shock. The first thing you want to do for broken bones is immobilize the joint. Okay. So keep that victim leg, the unaffected side, straight, and you can use that straight leg and strap both legs together. Do you have any questions right now? Any questions? So most of you have already noticed there's about 7 of you who have not completed your first aid as yet. So you will get more of the visuals in the session, but you have to make sure that you watch those videos and go through the training before the deadline, okay? And upload the certificates. Okay, so you said there's no questions.
As as there as it relates to what we're looking at now.
Anything related to the first aid?
I know I sent the message in the chat, but I think it got deleted.
What was the message?
If you had sent the grades in for the first link as yet.
Yeah, actually, when you finish the training, it actually gives you your grade. So you could go back into that training and you'll see the grade right there.
Okay, and one more question.
No problem.
I want to know if we felt that we did our best on the first exam, would we be able to get any like makeup work?
Well, like right now, I'm making notes for persons who are in the class. You know, first of all, we have 12 people in the class and only 3 people showed up, right? So it wouldn't be fair for me to send a grade to those people, right? Then we have persons who are not involved in the class. Even though Ms. Strapp is here, she's actively, obviously having another conversation with somebody else. Okay, so it's like you have to be involved in the class. You have to be involved. Okay, and I'm quite sure that if you are involved, you will get high grades. Okay, did you take the second test for the first day?
I took the first exam and I did the first link, but I only see the final exam coming up and the next link.
Yeah. So no, so did you do the next link? That's what I'm asking you. Yeah.
I'm not done with it yet.
You
I see it
haven't
was
done it.
I started it, but I haven't finished it.
Okay. All right. And when you finish, you'll see the score come up right there.
Okay.
Mrs. Moxie, I didn't see a grade as neat either for my first link. I only saw my first exam grade.
That's what I'm telling you. In that first link, once you are done, just before you download that certificate, the grade is right there.
Okay.
Yeah.
Well, okay. So that the grade will be posted to Moodle or no?
I could post it to Moodle, but it's right there.
I feel like if you posted it to Moodle, it's not easy. It's not easy to find.
It's right. It's right there.
Okay.
But if later on this weekend, I'll look it up and put it in.
Okay, because I think it'll be easier.
No, it's right. It's right there though. You probably just completed it. And
exam, it was a crusher. I thought I would have had probably more time. It crushed me. So I'm hoping to do better on the next one. I was gonna ask about the makeup work as well because I didn't like the grade for my first exam either.
Well, good for you, both of you. You're here, and that's important because when I'm looking at giving people bonus or giving them opportunity, at least you should show up to class and be interactive in the class.
Yes, ma'am.
I don't know. Miss Strap must see a school teacher because she's still talking. Okay, so heat exhaustion now. The worst is heat stroke. So heat exhaustion leads to heat stroke. So what you have is someone who was outside doing the gardening, they start to feel hot and flustered. And then they say, I'm going to push myself another 30 minutes. And when they push themselves another 30 minutes, they end up collapsing. Okay. And when they collapse, they nobody's there to rescue them. They can become dehydrated and other issues can occur. All right. So you want to move to a cool place, lay the victim down, elevate their feet. That sends more oxygen and blood back to the brain. Loosen the clothing and give fluids only to heat exhaustion. Do not give fluids to heat stroke. Okay, that's the person is unresponsive. Instead, you want to spray that, get them out of the heat and spray their bodies down with a water hose or something, or apply cool compressors, as it says there. That's the heat stroke. When you talk about seizures, heat stroke. Okay, so call immediately and cool the person down. Okay, fainting. You want to check for breathing to make sure the patient did not actually start hard, did not stop. Elevate that leg up and get that victim to the hospital. He or she does not become responsive. Seizure. Remember, do not put any spoon. Do not hold the victim down. Just turn the victim over to the left. Time it. Let the doctor know the victim was having a seizure for 2 minutes, 1 minute. That's very important. Remove any loose clothing. Check for breathing. If nothing is in the mouth, make sure that there's nothing occluding or tightened or gonna hit the victim's head. All right, call 911 immediately. Just a quick thing here. Which is the worst kind of burn? First degree or third degree burn?
Third.
Third degree. That is correct. Third degree. All right. If a particle gets into the eye, do you flush it with water or do you rub the eye?
Flush it.
Flush it. That is correct. For inhaled gases, that means it's environmental. Do you make the patient vomit or you move the patient to fresh air?
Move to fresh air.
Yes, remove the fresh air. Okay. And for heat stroke, call 911 or don't call 911.
Call.
Yes, call 911. That is the worst one. Heat exhaustion, you can probably not call. All right. So we got it all right. All right. So just some of the things. Medical emergencies can happen rather quickly. We need to be calm. That's why I remember in the first slide, I said assess yourself. Okay, do I know? Do I have the information? Consider being certified in first aid and CPR if needed. Okay, and that's what you're doing now. And I think some of you are teachers and some of you may be in education, and those things do happen. Okay, those things do happen in those environments.
Excuse me, Dr. Allen.
Mhm.
I'm looking at the certificate now for myself.
Mhm.
It says recognition of completion successfully completed.
Mhm.
And that's all it's saying. And the
So
completion.
it's in the systems when you have to go into your account. It is there, and that's how I'm gonna get it. So I know it's there. Yeah, you just have to go through it and find it. It's there.
Okay.
The final grade is there.
Automated.
I think when I looked at it, it may have been 100 for most everybody, but you can look at it again. It's there. Okay. So medical emergencies now. So those were injuries. So now you look at asthma. A person who's having asthma, you need to give them the inhaler. You need to give them the inhaler. A person's having anaphylactic shock, you want to give them the epinephrine. A person's having seizure, you want to place them on their left side. Do not restrain the victim and don't put anything into their mouth. When you have your bleeding, you want to apply pressure and elevate. Okay, make sure you're using some sort of gauze or some sort of cloth between you and the victim. An open wound is the same thing. Just apply pressure and elevate. Burns, you want to put cool water as it comes out of the tap. Okay, cool water as it comes out of the tap. You do not want to put anything on there that is going to further cause more damage, right? Do not cool it for more than 10 minutes. This can lead to further damage, all right? If there's any blisters, which is your second-degree burn, you just want to apply a loose gauze on it, and you want to not burst those blisters. Keep those blisters intact, all right? Electrical burn, once again, you want to get that victim to the hospital and initiate CPR right away, all right? Head injury, do not move the victim. Do not move the victim, all right? Place something against the head to keep him stable. So if you have an 8-inch block, put the 2 blocks there so the person cannot move his or her head. You could put your knees on the 2 sides of his hair, all right? Keep that victim head stable. So we know that anybody who is suspected of having a head injury would include car accident victims, persons who have fallen more than 6 or 5, 7 times their height. You know, because we could all fall off the bed, but if a baby fall off the bed, that's something else, right? Anyone who's complaining of neck pain or tingling or numbness, all right? The job of the first aid is to manually stabilize the neck until help comes. Sprains. The word or the acronym is RICE. Rest it, ice it, compress it, and elevate it. So you want to rest it, okay? That means come off of it. Apply ice for at least 20 minutes. Compress it with a compression bandage and then elevate it, all right? If the victim has an aversion to cold, place wet, cold cloth between the ices, because remember, ice burns, all right? Ice do burn. So you wanna make sure that you keep checking and do not keep it on for more than 20 minutes. Dental, we're almost done. Dental injuries, you wanna put it in a cup of milk or have the victim spit into a cup, and then you want to rest that tooth in there and get that victim to the hospital. Make sure you remember to label these items. So if you have an amputation or you have a tooth that is missing, then you want to make sure that the tooth or that finger goes with the victim. Hold 1 second, everybody, please. Hold 1 second. Okay, good. We've already talked about environmental injuries as relate to heat exhaustion and heat stroke. But another thing is snake bites and cold injuries. Remember, you're not a rescuer. So if you see a snake, you need to run. Okay? Do not suck bone. What you want to do is you want to just check the victim afterwards. So if you have 2 holes versus 1, okay? So 2 holes on this versus 1 to discover whether the snake is poisonous. Okay. So you want to look for the color or the size or something to let the health facility know whether or not this victim was bitten by a poisonous snake or not. All right. Cold injuries. We're not normally in cold areas. Hypothermia means that immediately you want to put if something is cold, you don't want to rewarm or cool down the area in the area that the victim was in. Say for example, person's outside at changing their tires and they get frostbite. You want to bring them inside the house. Okay, you want to bring them inside. So immediately begin rewarming. Remove the wet clothes and wrap the body surface with anything at hand. Just wrap it. Okay, do not put cool water on it because if you do it, that's just going to cause more chunks of heat to get on. And then, more chunks of ice to get on. And when the ice gets on, it's going to further exacerbate the issue. Drowning, get the victim out of the water as soon as possible. If the victim has a head injury, remember you want to stabilize that head. You want to lift that person up in one. You don't want to drag him out. And if you're alone, give the 5 cycles before you call 911. And then poisons. I said this already. You want to brush off any powders or that's on the victim. Any ingested poisoning, if the person swallows anything that's ingested, do not ingest any milk, charcoal, or anything because you do not know which poison the patient took. Place the patient on the left side, call the poison control, or look in the back of the bottle, and that will give you the instructions. And finally, shock. This is developing the person loses a lot of blood. If they have any type of allergic reaction, or if they're having a heart attack, person's going to feel cold, they're going to feel dizzy and restless, they're going to be vomiting, and they're going to feel thirsty. That's the number one thing. If you go to a motor vehicle accident, the person hit their head, they go into shock. The person's going to say, I'm thirsty. That's a sign that this person is going into shock. Do not give that person at that accident scene anything to drink. All right. So the number one treatment is to stabilize the victim. Put the victim on his or her back, keep that head stabilized. All right. And if the bleeding is visible, you want to then go ahead and apply pressure. Any questions before we leave? Other than the questions that I have.
I have. You said you it's one bite, it's poison, and if it's two, it's not? Or if it's two, it's poisonous, and one,
So
it's not?
one is poisonous.
One
Mhm.
poisonous, okay.
My question to you is not of what we just discussing, but in reference to the CPR thing that we supposed to do on the 26th. Is it possible that we can do that a bit earlier? Seems I have to do that same performance for another class, and I really don't want to use an actual person to do it because my teacher wanted us to use someone from high school or an adult to do the procedure.
Oh,
But you,
yeah,
but
what
due to
happened, what
COVID-
happened is the 26th is the date of class. And so between you, if you're doing it in my class, you're doing another class, that's good. I mean, you'll be an expert.
I have to do it for swimming as well. From
I say
Mr.
that, I
McKenna.
say that, I say if you do it, I say that you'll be an expert. That's good.
Okay, because I have to
Friday.
upload, I have to upload it on Moodle on the 26th. See, the session that you were given to us was between the hours of 1 and 2, but my presentation have to be posted by 10 o'clock that morning. So I was trying to see if I could get you to do it a little earlier than that, so I could be able to post my presentation in time.
Actually,
instead of having to do it twice.
Okay, I see what you're saying. Yeah, but this year is an actual exam on the 26th.
Oh, okay.
Yeah, that's an exam. That's an exam that we're having on the 26th.
Okay.
Mm-hmm.
Are we still doing the I think you were gonna show us how to do it on a
Yeah,
think
what we were supposed to do when we meet via Zoom on the 19th is decide which day, which time, whether we're gonna come on the 26th or the day, or the whatever the other last day of class is, which I think is the 5th. We're gonna decide that day. Which day or which Friday we're gonna meet to do what you call the skills.
So my next question is, seeing as I have to do it for another class, if I do it for the other class and I just pass you the video for it, would it be the same thing?
No, we're gonna be face to face.
Oh, okay.
Would everyone have to do it face to face?
Yes, that's a face to face skills.
Because I'm on a family island, that's why I'm asking. So I would have to be something that I work out to come to the on campus and do it because I'm on a family island.
Yeah, once you have to do that, once you have to fulfill your objective, you will have to figure out how you're gonna fulfill that objective. And we're gonna be meeting on that day. And you could just forfeit the 20% if that's what you want to do.
No, I need the 20%. I don't mind coming. It's just a matter of planning.
Yeah, you'll know by then. You'll know by that day. Okay. All right. So thank you all so much for showing up. Thank you.
Good afternoon.
Okay, don't forget your assignment.
To upload,
Yeah,
to
your
upload the-
assignment. Yeah, and I see some people are sending the assignment to my text. I mean to my email. Remember, it's on the Moodle. I'm not even looking at it. So make sure if you did it, that you fix that.
when you said
I
assignment,
sent mine today. I finished it. I posted it on Moodle.
Yeah, no, Moodle is where you're supposed to do it. Moodle is where you're supposed to do it.
Yeah, I made a mistake. I forgot you said not to send the assignments through email. Most of the other classes are getting them on email, so that's why I made that mistake.
Yeah,
But
okay,
I
but
corrected
make sure
corrected
you
it.
fixed it. Make sure
the
you fix it.
assignments are the links, right?
Yeah, there are links there.
Okay.
Okay, everybody, have a good day.
Me too.
All right, Professor Adley. Take care. And I
Okay.
apologize for my tardiness.
Okay, no problem.
All right. Thank you.
Bye-bye.